Getting a diagnosis of breast cancer is a life-altering event. What my patients need to remember at all times, when they start the therapy, when they complete the therapy, is that they are doing this to cure the disease. This is a curable disease.
When picking a physician, it was very important for me to know the background of that physician, to really understand their clinical expertise. Was extremely important to me, as well as their bedside manner. So I took the time to really look at their background, research them, talk to other people that may have utilized their services before, and that's how I made my selection.
The decisions have to be made by the patient in conjunction with the doctors, you know? And therefore, it's very important for the patient to get good information.
My mother and my kind of focus was to be very educated about what was going on and to ask all the questions.
I try to make sure that they're comfortable calling us whenever they have a problem, as they're going through treatment. Because some people, I guess have been sort of trained not to bother the doctor. But in our case, we really want them to call us.
I thought about how I wanted to face this going forward, my treatments. And I thought, I don't want it to be a battle. I'd heard of all these women who have battled cancer or fought it. And I didn't want to do that because from my perspective, if you have a battle, somebody's got to lose.
I was amazed how much information I misheard or did not hear.
She's so immersed, she has so many thoughts going on. She hears 75% of what's said, probably remembers about 10% of it. And so I had notebooks with me I was a stenographer taking down all the notes that I possibly could, whether I understood them or not.
When they ask many questions like, what kind of cancer did they say I had? Or what am I supposed, now what is the next step? And what is the doctor's name? And what kind of doctor is that? You have the answer.
I decided on my treatment first and foremost by listening to my doctors who laid out all the options available to me.
I think the comfort level that I think we try to convey to the patients is that with the help and the aid of their physician team, that they can have a perfectly normal life expectancy and a quality of life that's equal to their situation even before their diagnosis.
And I thought this was my private diagnosis. But once I let them into my life, it was amazing. They were there to do everything.
My daughter wanted to be there every step of the way because she wanted to be informed. She wanted to know exactly what the treatments were going to be, exactly what I was going to go through.
I took her to her doctor's appointments. I would take her out, run her errands with her.
She took out her little Palm Pilot and she scheduled all the appointments. She allowed me to concentrate on just getting better.
I didn't know where my support was going to come from. And so there are people that had gone through this experience that I didn't know about that were there for me.
It really helps to have people around you that you can talk to and nobody's covering up anything. It's all out in the open.
I wrote down every positive thing that my doctor said. And that was an interesting aspect to learn that once you hear that you have cancer, there can be good news that comes after that. There are certainly good aspects when they report the tumor is small or that it's not in your lymph nodes. I wrote down all the good news so that on my own I could review that when I was having fearful times.
Don't go on the internet. That's my number one, because it scared me half to death. I would read and I would get so sick to my stomach reading that stuff. And yeah, looking back now, or looking back even a few months ago, none of that stuff applied to me.
There are good sites out there, but you need your clinician or another resource to let you know which are the good ones.
I just never questioned myself. I was really sure that things were going to work out okay and that whatever happened, the resources would be there for me and the help would be there.
Eventually I came to see that my body that was in general very strong and healthy with the acceptance of this tumor that was in me was going to carry me through my treatment.